My name's Lauren Pearce, and I came to work at the clinic through being a massage therapist, which then Bill asked me to do some support work with him, which incorporates the WINS program, the kinesiology, and preparing the patients for him. So that's how I became to working at the clinic. Has treated myself, my mother, my child, my husband, all for various reasons. Myself, I had a lot of gut issues. I have thyroid autoimmune disease. I've always seen naturopaths. I haven't really had a lot of structural problems chiropractically, but I think his approach of the combination of the two, I saw some really, really great benefits. The kinesiology, I'd only seen it work. I'd never had it done to me. And the fact that you can get so many answers within one consultation without blood tests and scans and urine tests is a really big plus, I think, because you can get on the track straight away. I think it also, I think the other thing that's benefited me is that, it's not about black or white results from blood tests. It shows up sensitivities. It's not whether you're allergic or not, or it shows any deficiencies in the body, whether it be minor or major. And he looks at all of them together and then looks at the whole picture of how your body's working. Even myself, before he even comes in the room, you can see that the patient a lot of the time has exhausted every other option, and they're here just going, I've got nothing, please help me. And they've been referred here by someone else who's had really good results, and just the classic signs that come up like candida and bacteria and things like that wouldn't necessarily show up in a doctor's surgery. They come straight up, and then he comes in and then he'll use his the kinesiology and muscle testing, and on top of what the results that I've got from the food testing and the deficiency testing, and then look at it as a whole picture, get some history from them, and they can walk out just with such positivity and such hope because they've got some answers.
Yeah.
When he talks to them, I think they really resonate with what he says. Yes, you can see their eyes. It's like this aha moment that they get, and I think they walk out here with just so much more hope than they walked in with. So at first, when he showed it to me, I was like, whoa. But then once you start putting it into practice, like looking at it on a sheet, you can be really quite overwhelmed by it. But then as soon as you put it into practice, it all comes together and it works. And the more you do it, it just becomes a pattern, and you just walk in there, you can just do it without even thinking now. You get your flow going, and you've always got your charts to refer to if you need them. It's they're just there. So it's quite easy to incorporate, and the patient's body's just giving you the answers, really. It's very hard to explain. It's you're in awe of his knowledge, and I learn something new every time I come to the clinic. It's not just the same results, the same testing. There's always something new he adds in, because a patient comes in with something that we haven't seen before, or he wants to treat a different way, because everyone comes in with different signs and symptoms, but they also, their environment is very different. So he just seems to be able to approach them in a way that they need it. So I think, the individuality that he brings to each patient allows you to really learn something new each time. The different approaches and psychology he also brings into it. I think, I love coming to work, and because I know that it's going to be a new and fresh day, and we're going to help people, definitely. And you can see the patient really, in awe of him as well.